So for cosmetic dentistry, we offer just about every option out there. We do traditional veneers, we do lumineers, which is a specialized type of veneer made by a particular lab. We do composite veneers, we do composite fillings, which are white or tooth-colored fillings. We can do limited orthodontic treatment. Just about anything a person wants cosmetically, somehow or another, even a bridge or a crown. Porcelain crowns are excellent for cosmetic work when a tooth is damaged. So the ideal candidate would be somebody who has, let's say, rotated teeth, discolored teeth, chipped teeth, fractured teeth, filled teeth, decayed teeth, anything like that, or just something about their bite or their smile. Many times we can just fix with dental work.
What kind do you use, and what can patients expect when they come in for some?
Yeah, so the typical veneer we use is called Emax. It's a newer material. It's just been out a few years. Great material, much stronger than the past material, and is very aesthetic, cosmetic looking, so it looks great. That's for limited cases. For larger cases, I might use something called Lumineers. It's a particular type of a brand, copyright, and they work great. They're just so beautiful. One of the finest things we can do for a patient to really improve their smile. So veneers are very good. They cover the front of the tooth, so if there's no major damage, we love the veneers. It's the best thing, most aesthetic thing we can do. For a more damaged tooth, let's say it's broken, filled, or decayed, or somehow I just can't get a veneer on it, then we can put a crown on the tooth, a porcelain, and basically that covers the whole tooth, front and back. And so yeah, there's a lot of options there. We can just make teeth look really good and strong nowadays because of recent improvements in dental materials.
Absolutely.
Mm-hmm.
Teeth whitening options. Who are the ideal candidates, and what sets that apart from, say, something store bought?
The ideal candidate for whitening is a person who, let's say they have just beverages that have stained their teeth, maybe they smoke or something like that. Some people, just because of age, their teeth have darkened. There's a number of reasons. Maybe they had an antibiotic when they were young and it stained their teeth. So these are all people, maybe they've had fillings and so on and so forth, and just there's all different mismatching colors on their front teeth. Just about anybody is a candidate for whitening their teeth. I mean, very few people are born with teeth white enough to not get whiter through whitening. So, but the ideal candidate is just the person who wants a brighter smile. And we can do that for just about anyone. I would caution a person who maybe if they have a whole lot of fillings on their front teeth, they might have to consider getting the fillings replaced, because when your teeth are real white, the fillings may not match if they're older or stained. The method we use is prescription, bleaching method. You can't get this over the counter. It's not something you get at Walmart. The Walmart brands, so to speak, maybe I shouldn't use that name, but the over-the-counter bleaching kits are not strong enough. The concentration is not high enough to effectively achieve the level of whitening that we can achieve in the professional setting, and that's what sets us apart. That's why the price is higher, the job is better, and patients are just more satisfied. I've heard they're just not typically very satisfied with the over-the-counter bleaching.
I would add to that, yeah.
Yeah.
So, right there in that camp.
Yep.
Okay, so patients tend to hate the phrase root canal, but it's come a long way. Can you talk about how root canal therapy has improved over the years and what patients can expect when they come to you for one?
Yes, root canal therapy has improved. Just our methods of anesthesiology have improved. So we're so much more gentle and caring than we used to be, I think is a lot of it. The technology of root canals, yes, it's improved. Our knowledge is better. It's still one of those things that does strike fear in the minds of people because usually it's associated with pain. They're typically in pain or abscessed or swollen or hurting somehow or sick before they even come in. So the two names become synonymous. But I find that root canals help people a lot. I mean, they just make them feel better. No one wants to volunteer to go through a root canal because it's time consuming. It's just an arduous, kind of an expensive procedure sometimes. But when you need one, you're glad to get it. I mean, you just walk out feeling better that day. And typical just light soreness for a day, mild, most people just take an ibuprofen or something like that. I would say it's nothing to really worry about, but it's a good treatment for a tooth that really needs it. And we only do root canals, obviously, when they're really needed. And the doctor would determine, who needs a root canal and who doesn't. So.
Excellent. Mm-hmm. You talk about dental crowns and bridges and who the ideal candidates would be for each of those.
Sure. Dental crowns and bridges are needed for people typically when they have large decay in their teeth, or if they have large fillings that have failed. I see that a lot. There's been billions of old mercury amalgam fillings placed. They crack teeth, they decay, they leak, they hurt, they fail, and they have to be the tooth has to be held together when it's crumbling. And that's what a crown does. It effectively seals and holds the tooth together. It's very strong, very durable. They look good. They look like a natural tooth. They feel right. Patients don't even know they have them in usually. Almost always they don't even know they have them in. After a day, it feels just like a natural tooth. And you brush and floss it. It does not come out. It's cemented in permanently. And same with a bridge. A bridge is merely typically 3 crowns or more kind of all put together to replace a missing tooth. If you have let's say a hole in an area in your mouth where you can't eat because you're missing a tooth or something, either it wasn't there or it had been pulled, then we can use a bridge to replace it. And they're very durable, they're strong, and they're permanent. They don't come out. They just work really well. Millions of these things have been done and are in the mouth successfully today.
Excellent. Office set up to handle emergency visits. How soon can you get a patient in who's experiencing an emergency?
Emergency visits, that's key. We focus a lot on that. We try to get people in same day, at the very latest the next day, but almost always same day. We will almost always see somebody on emergency that day. We allow room in our schedule for emergencies. We think it's important when somebody is really hurting and they need someone, the last thing they want to do is have to sit on the phone and try to call 3 to 6 dental offices just to see who can get them in because they're so, quote, busy. So we stay even busier by seeing the emergency patients when they need us the most.
Excellent. I think this was related to what you were talking about earlier with implants, dental implant restoration. Can you talk about the options you offer as far as that goes and who the ideal candidates would be?
Yes. We definitely offer the service of dental implants to patients because it's a great service to replace a tooth without cutting down the adjacent teeth. If they have 2 healthy teeth on either side of a missing tooth, they don't always want to cut down perfectly healthy teeth for a bridge, although that is an option. But the implant can be placed right in that one missing tooth area without disturbing the other teeth around it. And you can still floss it. That implant will never decay and never need a root canal. It probably lasts a lifetime. And it's a great restoration. I used to place my own implants, so I know a lot about it. I still take tons of continuing education on the placement of implants so I can advise people on their implants and who's a candidate and who's not. But I no longer do, but I do have a periodontist that I refer to, and he's excellent, really great at placing implants, and he's close, like just up the street, so he can place our implants, and then Dr. Clemens, my associate, or I will place the restoration or the crown or bridge on that implant or those implants. And the nice thing about the implant is it's a strong foundation. You chew with confidence. I mean, when you bite on that, it's not moving. Braces won't even move an implant. They're solid in the bone. They're not going anywhere. So that's why we like implants.
Great. Typical tooth removal or extraction.
Well, we focus a lot on that. My training is very strong in that area. Dr. Clemens and I both focus a lot on extractions and a lot of continuing education. We stay up on the latest. I read extra outside. When I go home at night, I'm one of those nerds that reads about oral surgery. I just like doing that. And so anyway, we try our best to care for our people and take care of them. And if it's a difficult extraction, we just deal with it. We're trained to do that. We have all the instruments, the staff capabilities to handle the most difficult cases. Wisdom teeth, I do probably 90% of our own oral surgery right here in office, just because I find it's a service, it's a convenience. Sometimes I may not want to do it because it's difficult, but usually I take on the challenge. Now, impacted wisdom teeth, impacted third molars, where they need to be put to sleep, usually I will refer that. As I said before, though, we can put people to sleep, patients to sleep, if they choose that option here in this office. But typically for one tooth, we will not put someone to sleep. But yes, under local anesthesia, we take out routine teeth all the time.
Excellent. My wife would love to hear this. What types of snoring solutions do you offer to patients?
Yes, we have a device called the TAP appliance, TAP, and our lab makes that. It's very effective. So many snoring options out there with surgery, and the doctors that treat it, pulmonologists and so on and so forth, they have a hard time with that. They really do. They struggle with it, and sometimes they refer to us for that. The oral appliances for snoring are very effective. Basically what they do is they posture the jaw forward, and it keeps the tongue from collapsing back in the back of the throat and the jaw, and minimizing that airway and stopping the airflow. And that's what makes the sound of snoring, as it tries to pass through that narrow opening and things vibrate. So it's a problem for a lot of people, but the oral devices do seem to work. The compliance is better and the results are better than with, say, a CPAP. You've probably heard of one of these, a medical device called a CPAP. So for people who have tried that and it's not worked, then usually the oral appliances work.
I definitely need to get me one of those.
Mm-hmm.
It sounds like in the future you may offer sleep apnea services. Is that correct?
Yeah, Dr. Clemens or the associate, one of those two here in the future are definitely going to be getting more involved in that with that therapy, yes.
Is that something you'd like Dr. Clemens to make a video on and we could hang on to it until later, or would you rather?
Yes, please, because
okay, sure.
Yeah, I do not purport to treat sleep apnea, because that's a whole sleep study, and there's a medical follow-up. You really need to do that right. If you're going to claim to treat sleep apnea, you have to monitor that. You have to test it before, and you have to test it after the device to see, has it really improved their sleep apnea.
Could you tell us about how you heard about SmartBox and got connected with Colin?
Yeah, I received a mailer, believe it or not, picked it up, and my wife, I have to give her a lot of credit, because she has an eye for things that are excellent. And I don't know why, but every once in a while a mailer will come through, and I give her these things every day, every day, multiple pieces, but she has a way of picking out the good ones, and you guys are one of the good ones. You guys are like a gem, like a diamond to us already, and we can see the potential. We're so happy to have you guys, but we found some of our consultants this way, some of our advisors, just various things this way. So yeah, I just have to give her a lot of the credit. I find them, I send them to her, she picks them out and uses them and runs with it, and that's how we found out about you guys. So
she's kind of the oracle.
Yes,
yeah,
she is.
Which one of these? This one feels right.
Right,
exactly.
Right.
What are you hoping we can accomplish together? What are you hoping to get out of the services we're going to provide for you?
I want SmartBox to give us exposure, to provide a venue for patients to learn about our dental office, not just learn about it for the first time, but also learn about us more in depth, and learn about my great staff, the great services we have to offer. We have a great thing here. I think any patient who walks in the door is going to be happy and satisfied with their services. They're going to come in with stuff they need and they want, and hopefully they get it, and they feel like we're exchanging in abundance with them. And that's what I want SmartBox to do, is take the public out there and help them come in here and be happy with having done so.
Excellent. Yeah, for having no prep, I thought you knocked it out of the park.
Yeah, good
Oh,
job.
good. Thank you.
So-
You guys made it
So
easy.
good.
Very
That's
relaxing.
right.
Very well spoken about
Thank you.
your office and your
We do it
services.
enough time.